Good afternoon, everyone. Now we are going to start our session. Welcome to the eighth session of the Bibliometric Manuscript Writing Program. We are excited to have you join us today as we are moving towards the end of the session, end of the program. So I'd like to take a moment to thank the organizers, our speaker, and all of you for your continued commitment to enhancing your skills through this series. So today's session centers on a vital component of any research manuscript, that is the result section. So this is where the essence of your research is presented and interpreted, and clarity here can make a significant difference in how your work is perceived. We are fortunate to have Dr. Namrata, um, who is an expert in bibliometric analysis and manuscript writing, leading us today. She will provide invaluable insights on interpreting results, writing the result section effectively, presenting and interpreting illustrations such as tables and graphs, the importance of clarity in conveying findings and their interpretations, linking results back to the study objectives and implications, and a hands-on demonstration on writing the results section, presenting illustrations, and so on. So, her extensive experience in guiding researchers through manuscript writing makes her the ideal mentor for today's topic. I'm requesting everyone to mute yourself. Okay, Dr. Dagal will deliver an interactive presentation followed by a hands-on demonstration. There will be a question and answer session. So please note your queries, and we can take the queries in between the session and also at the end of the session. So without further delay, let's welcome Dr. Namrata to guide us through this essential part of manuscript writing. So over to you, ma'am.
Ravita, for a kind introduction. Hello, everyone. A very good afternoon to all of you. Today's discussion will be focused on results section. So, overview. What we are going to be looking at today is importance of clarity in conveying results and interpretations, guidelines for presenting and interpreting illustrations. Just a minute. I'll do slideshow. Interpretations of results in relation to the research questions and linking results back to the objectives and implications of your study. Before diving in, I would like to request all of you to keep yourselves muted. And one more request, please interact with me because it is going to be a long session and I want everyone to be awake till end. So please interact. So let's start the session. Bibliometric analysis results are very different than other studies. It is really important to mention everything clearly in your results section. What makes it different is that it includes different kind of graphs, different kinds of beautiful graphs, but those graphs are a bit of a puzzle to figure them out. So the clarity is required because of effective knowledge translation. Many researchers who are not familiar with bibliometric analysis, please keep yourself muted. Thank you. So many researchers are not familiar with bibliometric analysis, and therefore they are not able to interpret the graphs and network analysis visualizations. So to effectively translate our knowledge, what we're trying to share, we need to write the results section very clearly. The second point, unlike other studies, bibliometric analysis is not limited only to researchers. Many policymakers depends on their decision making, um, and if we write our results clearly, it supports evidence based decision making. It enables a comparison. If we clearly mention our findings, we can compare the findings with other bibliometric studies, and it will provide us more insight. The next topic is key guidelines for presenting illustrations in bibliometric analysis. First of all, you should make sure that the visualization type you are choosing is appropriate for your analysis. We have already talked about this in previous sessions. If you are doing collaboration analysis, network diagrams are good. If you are showing temporal patterns, then use overlay visualization. If you are highlighting the intensity of the relationship, then use heat maps and implement line graphs for temporal trends. Ensure visual clarity. Maintain consistent color scheme throughout the analysis. Bibliometric analysis graphs are very colorful, and there will be a lot of colors, but you should select similar type of analysis for every for author, institution, sources, whatever you are evaluating. If you are doing network analysis, try to do network analysis for all. If you are including overlay visualizations, try to do overlay visualizations for all. So it will give you consistency in your manuscript. Use consistent font size and styles. This will not be possible if you are using different softwares, like sizes and font styles mainly available in Pure is different from BiblioShiny. So you'll not be able to match them, but at least make sure that from one software you are using one writing style, one font style. While I'm telling you all these guidelines, I created them keeping in mind the two main softwares, VOSViewer and BiblioShiny, that I more commonly use. But if you are using some other kind of software like Cyval or something else, um, these guidelines might apply, or you need to adapt to your according to your software. Then avoid cluttering by limiting the number of elements, and whatever you are doing to limit the numbers, please mention in backend so that your diagrams are reproducible. Provide scale indicators wherever applicable. In most of the diagrams, software automatically provide the scale indicators, but in few diagrams it does not. There you have to mention in your ligand clearly that what the color coding or size actually represents. So let's move on and with more examples. So I want you to look at it and share your opinion. What do you think? What this diagram suggests? Anyone? I want you to volunteer someone and tell me that what this diagram represents. Anyone? No one? Is it showing most productive authors? Or is it showing something else? Hello? Am I audible?
Yes, ma'am, you are audible.
Anyone?
I think it is
No
about
one.
co-authorship.
Yes, it is about co-authorship. So don't confuse it with most productive authors. Sometimes they might be common, but it exactly represents co-authorship authors. So when I say that choose appropriate visualization, I mean that whatever you are writing, you show the visualization which actually represent that. This shows the most productive authors. Anyone take a moment and reflect upon this. What do you think? How this graph is? Is it good? Does it require any improvement? Anyone?
Yes, ma'am. It shows many clusters, and we
Yes.
cannot identify them properly. So we can select less keywords with the main keywords, and then we can go forward with this graph. And it's a co-occurrence all keywords graph. So we can select few keywords which match the most to the main co-occurrence.
Good observation. This graph is uh, good, clear, terms are visible, but the font size is very less. So if we are just concentrating on the co-occurrence of keywords, this does not highlight the connected. There are many other nodes you can see at the sides that are not connected. So it is for finding research gaps where there are many unconnected dots, but not for presenting in your paper where you want to show co-occurrence of keywords. Thank you for your response. Now this is another graph. Anyone wants to share their opinion? What is wrong with this graph? Or if it of or right, then is right with this graph. Anyone? Please interact.
I think it doesn't show the connections between the keywords.
Yes, good observation. It does not show connections. And why it does not show connections? What do you feel? What is wrong?
Maybe search strategy.
Okay, good try. The problem with this is that the proportion is not appropriate. The sized variation that should be there, it's not appropriately selected. So there is a big difference between the node sizes, and the most common used keyword is obscuring the almost all the field and not allowing us to see the other nodes and connections. So I want to mention that this graph and this graph is created using the same data, the same file. But what makes them different is the thresholds and filters I have used to create them. That's why it is very, very important to mention clearly in your ligands that what filters and threshold you are applying, so that you can again generate those. This is another graph. Here, anyone who wants to try what is right or wrong with this graph? Anyone? Or should I tell you? Okay. This graph is telling us about the keywords and their clusters. But are you able to see the connections?
No.
Yes. So this is the problem. Clusters we can see, but we cannot see how the red cluster is connected to purple and how the other clusters are created and how the nodes are linked with each other in one cluster. So we will not be able to identify the connection. So this is again not a good graph. Now, anyone wants to reflect upon this? In my opinion, it is a good graph. Anyone who wants to say that there is some problem with this graph?
No, ma'am.
Okay, in my opinion, it is a good graph, and because it is showing the connections, it is showing the research gap, it is the proportion of the nodes is appropriate. So it is a balanced view where we can analyze it more effectively. All these graphs that I've shown you, this, this, and this, are generated using one file. So I chose this type of graph to include in my paper. So you should keep in mind how you can make your figures more clear. Any questions? Okay, let's move on to next slide. This is another image. Here I want to show you, this is a complete graph. Why? Because we can see the keywords clearly. We can see the year, all the X's are well mentioned. And we can see the nodes here. Also, scale is also there. So it is easy to interpret this, easy to understand this. Let's see one more. Anyone? Any improvement required in this graph? Anything wrong with
Yes,
this graph?
I think the scale is not mentioned.
Yes, exactly. So Biblio Shiny does not provide scale indicator with such graphs. So either you have to create it or mention in your ligands that what these colors and their are indicating. Okay. This is for every study and it is not different for bibliometric analysis. Tables and figures should stand alone. This means that be able to interpret your tables and figures without reading the whole text or without reading the whole article. So your ligand should be such that gives sufficient information. Now move on to next slide. Include essential components. As I shown you in the image, label axes were clear. So you should always try to check that whether it is clear or not. Provide data source information. which data source you are using, PubMed, Scopus, Web of Science, whatever you are using, mention it. Include time period covered. If the graph is showing the time period, then you can write that. Otherwise, mention in ligands. Note any data filtering or threshold applied. I've already told you how the graph can be very different using different thresholds. Include clear ligands and labels. Consider mentioning what the various components represent. For example, nodes and lines. If you are creating co-authorship, then the nodes will represent authors. So, and the lines will represent their connections. So you need to mention that in your ligand. Follow technical standard of the journal while you are presenting the graphs. Some journals require more than 600 dpi, and it varies journal to journal. So first you select the journal and then you should start your analysis so that there will be less duplication of work. And placement. Position related visualizations near each other. There should be a sequence in your manuscript. If you are talking about authors, then try to add everything related to authors sequentially, and then uh, institution, country, sources, and then thematic analysis. Or you can do vice inverse of it: countries, institution, authors, sources, then thematic analysis. But there should be a sequence, there should be a flow. It should not happen that you are presenting one graph of author, then another graph of institution, then another graph of co-authorship analysis. That should not be there. Try to maintain a sequence. Use consistent sizing for similar type of illustrations. I hope I'm clear till now. Okay, let's move on to next topic of today, interpretation. Key guidelines for interpreting illustrations in bibliometric analysis. Data context and quality. Verify data sources and coverage period. Account for the database specific biases. Consider any limitations in data collection. Check data completeness and accuracy. Understand the scope of included publications. So, for interpretation, first of all, we should have some context in our mind. For this, we need to do literature review, a thorough literature review while we are considering any paper. We should mention all the database or data specific biases and focus on what type of findings you are getting from your data. For example, the findings are from the PubMed from duration 2015 to 2022, like that. You need to mention clearly. Pattern recognition. Add brief explanatory notes highlighting the key patterns. Now, when you see a figure, what to interpret, how to interpret that. So first of all, you need to see key patterns, identify key patterns. What is happening? If it is public number of publications, then notice, is there any sudden spike in that graph, or there is sudden decline there, or the number of papers are consistent over the year, try to check and try to associate that change with some policy change or some event. For example, if you see that number of papers on stress were very much increased during the time of COVID. So try to link these things, that what can be the reason for that increase or decline. Amit sir already mentioned in his lecture that he observed some changes when WHO declared one theme. So many major organizations, they declare themes. There must be change in the graphs. You will see that change in the publications or your graphs. And look for unexpected relationships or clusters. Look what is not associated with other clusters, where the clusters are accumulating, where the nodes are more accumulating. Try to note that kind of patterns. Consider both global and local patterns. Examine any anomalies or discontinuities. Temporal considerations. If you see, temporal considerations means over time what is changing. So try to notice if there a time when the publication was very less, recognize data accumulation pattern, account for any historical event or policy change, consider evolving research practices. Field specific context, consider discipline specific publication norms, consider language and geographic biases. As Shiva ma'am has already told in her lecture, that you cannot compare two journals of different disciplines as their impact might be different. They cannot be compared. For example, Journal of Humanities and Journal on Chemistry or Pharmacology will not have similar publication norms. So if we are getting multiple disciplinary journals in our results, then we cannot compare them directly. We need to mention that what is the reason of difference of the impact here. Impact assessment, evaluate both quantitative and qualitative aspect. Not only that how many times what have been cited, but what theme is more cited. We should also focus on that when we interpret our results. Recognize limitations of impact measures. Whatever impact factor or measure we are using, we should mention what are the limitations. As Shiva ma'am already discussed, that why we cannot trust completely on H index for authors. As we cannot compare two authors where one have two publications with 100 citations and the another have 10 publications with 10 citations. So the comparison is not possible. So whenever you are using some impact measure, you have to think, while interpreting, you have to think that why there is so much difference and mention this. Most of the reasons you will write in discussion section, but you have to think about them while interpreting the results. Results back to the objectives and implications of the study. Linking results back to the objectives ensures that the findings are relevant. coherent, and valuable. In the biomedical domain, this involves aligning the outcome with the study's predefined aim and explaining how the insights may impact future research, practice, or policy. By linking results to objectives, you ensure that your analysis is not just a collection of data points, but a coherent story that answers your research question. There's no meaning in just presenting most common authors, most common institution, most common sources. You need to then draw some conclusion out of that. That which kind of institutions are producing more paper and why? Which countries are producing more paper and why? They have more institution, they have more economical facilities, or what is the reason? Or they if they are publishing more on particular disease, so it might be the case that in their country, in their region, that particular uh, disease is more prevalent. So we need to find answer that why the results are what they are. Revisiting objectives. We need to think about our objectives and try to compare with our findings, and we should try to connect these two. Is the result or finding answering my question? We need to check that. Suppose your objective is to track trends in AI research, and your analysis shows a significant rise in AI related paper publications over the last 5 years. Now, in that case, you need to connect this finding with your objective and mention that in answering your objective. It will be more clear with the subsequent example. If, let me show you one figure. So, look at this graph. Now I'm going back to my objectives. My objective can be to identify the most commonly used biomarkers for psychological stress. Okay. This graph shows co-occurrence of keywords in publications on psychological stress. So how I'm going to find my answer here? Most commonly used salivary biomarker for psychological stress. Here, I can clearly see it's cortisol or salivary cortisol. Fine. Now, my objective can be to explore the thematic trends in research on psychological stress. This same graph will answer my question, but I have to focus on other details where I need to see this scale, and then I need to see how the research started, what keywords were used in the starting phase, and now currently what keywords are being used. Now, there can be another objective. I need to find research gaps. So I will focus which points can be connected with further research, where there can be a possible connection. For example, there's no study on immune function and dementia. Then I have to check this, that is there any research possible? Does it make sense to conduct research on this? Or you can see many, like many unconnected dots are here. Try to think about them. Can we connect them? If it makes sense, you can conduct a research on this. Now, any questions at this stage? Okay. So that's how you can see that with one graph, there can be multiple objectives and multiple interpretations, and keeping that in your mind, you need to answer your research objective. Here, this graph is showing, anyone? Collaboration of institutions. Okay, so if my objective is to identify the most influential authors in institution contributing to XYZ research, then I need to check what are the most influential authors, in which year, which institution is publishing more. So we can see here that Stanford University is doing good, and the biggest frame is of Stanford University, so we can mention in results. Then, implication for research, practice or policy. You will write this in discussion section, but the data you have to think about this data while generating your graphs and interpreting your graphs. Once you have linked the results to your objectives, explain the broader implication for the biomedical field. Consider how the results may impact clinical practices, future research directions, or policy changes. For example, it is an example for policy implication, how you think about policy changing. The rising trend in research on personalized medicine in oncology, especially in biomarker-driven treatments, suggests that healthcare policies will need to prioritize infrastructure for genetic testing and personalized treatment plans to stay aligned with emerging therapeutic options. The rising trend in research on personalized medicine in oncology. If the trend is increasing, we need to prioritize infrastructure for that. So that suggests a policy change. Proposing future research direction. As I said that we can identify the research gaps, we can also identify the emerging areas. The areas in yellow are emerging areas. So that suggest new research questions or areas that need further exploration. So we need to mention all this in result section, mention what policies can be made, how the existing policies can be changed, and what can be the future research directions. In conclusion, bibliometric analysis is a powerful for understanding research trends, but it is only effective when presented clearly. By following guidelines we have discussed today, you can ensure that your bibliometric results not only answer research questions but also contribute to broader discussion in your field. So, any question now? Is there any question? Okay, then I am starting hands-on.
There is one question in chat box.
Okay.
How to identify research themes?
How to identify research themes? The keywords itself shows research theme. So, see in this, these keywords are already showing research themes. Okay. If these keywords were used, the research is done on that theme. So, this is this also shows thematic evaluation of your research area. Is it clear?
नहीं वो तो फिर अरे
Yes,
पूरा
ma'am.
बैग में पेन रहता है हाथों में यार
Thank you for the question. So I'm starting with R. We need to give this command. We have already discussed in previous session. Will take few minutes to start generating graph. Please bear with me. We'll see graphs one by one, and you can ask if you have any query how to interpret them. I did not start. Taking a little bit longer than usual. Till now, anyone can ask question if you have any query. Select another file. It's not working. Look, this is already covered, that it will show you which details are there and which details are missing. Here in last lecture, someone asked me how to do a factor analysis. I will show it today. Here under the conceptual structure, we have one option, factor analysis. Okay. This is a dendrogram created by factor analysis. Here you can see the terms that are closely placed in the graph are closely associated. They are more related. And the terms at distance are less related. More the distance, less the association. So this is how we do factor analysis. From here, we can do text editing and filter data. If we don't want certain terms like animals or whatever, if we want to put the terms, we can upload the file here, load a list of terms to remove, and those terms will be excluded. So we have to make our graphs more relevant by excluding terms that are not contributing to our result synthesis. Now this is, as I said, it is most relevant authors. I've already shown you one graph like this. You can also use these details in tables. You can export them in CSV format, Excel format, PDF. You can recreate these graphs by downloading it in Excel, and then you can create graph as you want using Excel features. This is author's production over time. Here, the notes are related to the number of articles. This is PubMed file, so it will not show citation details. affiliation production over time. So this is how it shows multiple institutions production over time. We can see in which year which university has published how many papers. When you write the results, use this graph, you need to mention which was the pioneer in university, which is is publishing more currently. When there is a significant rise, you can compare the number of papers among these institutions. Here it is showing the number of documents by each country, and you can see multiple country publication and single country publication. So the blue line suggests single country publication. So we can see that in these three countries, there is no collaboration. They have not collaborated with any other country for their work. You can see the Brazil is the country that have collaborated with other countries. So that's what you are going to mention in results. Do not write directly what is there in the table and graphs. Try to write the results in a more comparative way. This is country scientific production. I have shown you one graph that it does not any scale you can see here. So to make the interpretation more clear, you need to mention in ligands. Once you download these results, you will not be able to see number of documents that is highlighting now. So you need to note this down while generating the figures so that you can write in your manuscripts later. Means similar than the previous author institution production over time. We will mention similar things as I told. We can compare the output of various countries. Currently, who is producing more, who was the pioneer country, and comparison of number of paper during different time periods. Here we can generate word cloud. This shows most frequently used keywords. So it is different than co-occurrence analysis of keywords. It is showing most frequently used keywords. We can do a little bit of editing. We can list synonyms. We can remove unwanted terms. We can change the number of words from here. If I want to select only, let's say 25, I'll write this. Hello, is it visible?
Yes, ma'am.
Yes, ma'am.
Okay. So if you see here in this graph, more highlighted words are humans, adult, female, and male. These terms are not very important for our result section. So we might consider removing them so that we can see other terms more clearly. This is just showing the demographic data. If we want to see the research, the themes, then if we remove them, if we exclude them, then we'll be able to see more subject related terms. We can remove the terms by uploading a file here. We need to mention the terms in a text file and upload it here. Then a tree map is similar to word cloud, but just the format is different. Just the arrangement is different. We can also see word frequency over time. We just explore what it is showing: human, female, adult. These are all very less specific terms. We can exclude them and then the results will be more relevant. If I can, let's say, I'll try. If I have a ready file with me, I'll show you how to remove. See, I have removed those terms. Now we can see other terms more clearly. So it is showing biofilm, crossover studies, dental plaque index, treatment outcome. Now here, the first line is also showing biofilm and the third one is also showing biofilm drug effects. So the similar key terms you can merge. You can mention the keywords in a text file and upload here. Sorry. Load a list of synonyms. Here you can upload the list similarly as I have uploaded the previous list, and these terms will be merged. So the results will be more clear and more relevant. Because if these terms are used 2 times, it will reduce their total number of frequencies. If we merge these terms, then the frequency would increase. In trend topic, from this diagram, we can see which terms were more frequently researched during which year. We can see in 2015, the most commonly researched term is human. So here also we need to remove these terms that are less subject specific. We can see that these are new terms. After 2022, the research terms most commonly used are inflammation, gingivitis, dental plaque, fluorides, microbiota. So this we will mention in our results, that these are the recently used terms in the published papers. When the research started, these terms were used. And this shows the transition, how the research is changing over time. Matrix map. This is a thematic map where there are 4 areas based on their density and their centrality. So these are the terms that are most relevant and most researched. These are the terms that are declining or emerging. It shows similar data for emerging and declining, but based on our knowledge or based on literature review, we can find which term is emerging and which is declining. This graph is here we can see how the terms are changing over time. In 2014-18, these terms were most commonly used. Which terms are declining, which terms are increasing, that all detail we will find here. Oh, citation we'll see in WASFIA. That is better there. Just- These are all similar things. The graphs will be similar with the institution and country production over time. So I'm not creating it again. When you open this, bibliometrics give you all these detail too. You can set your publication year from here, language from here. If you have not used the filters during your while you were downloading your data from the databases, you can also use filters here. You can see which types of documents are included and check whether um, for example, you have excluded editorials and you see editorial here, you can again go and exclude that particular article. So it gives you general detail about your data, how many documents, how many sources, how many authors. Okay. So I'm done with R. And Amit sir already told you how to generate report for this. So I'm not repeating all those things. Anyone? Any questions here? You have any graph that you want me to interpret for you? Hello,
Hello,
am I
ma'am.
audible?
Yes, yes, you are audible.
Any doubt you can ask now? Just waiting 1 minute and then I'll go to Vasir. I've already shown you how to create a file. So I'm selecting the second option. Then I'm going to select second option here. Next. I select dimension. Here, now I'll show you how to interpret diagrams, how to select their filters and threshold. So as I'm using file for dimension, the citation data is available. So here we can set two thresholds, one for documents, number of documents, and one for citation. So I'm adding one here. There are total 11527 authors. Out of them, 45 meets the threshold. If I want to include more authors, I will reduce the threshold. Now 100 meet the threshold. Now, anyone want to interpret this graph? These nodes are very, very small. So to increase the size, I will change the settings here to make it more clear. From here, you can increase the size. These note sizes are related to the number of documents. And these are the connecting link or association. If this is thicker, this line is thicker, then it shows that there is strong connection between them. More frequency of operation. I can change the weight from document to citation. Now the note size is based on number of citations. So when I write my result, I need to mention that the weight. Then only I'll be able to check whether it is representing citation or document or link strength or citation, normalized citations. When you write results, you also need to mention these things. Left side at the bottom, how many clusters are there, how many links are there, how many total link strength. If you want, you can also mention the number of authors in various clusters in a table in your article. Should I move on? If you want, you can also change the rotation. You can rotate this. You can flip horizontally, vertically so that more items are visible. You can change the degree to rotate. And check with which rotation you find most of the items. Because it's not possible to include them all. So try to keep maximum number of items without compromising the clarity of the like this. This density visualization will show the strength of association. This is overlay visualization we have already discussed in 2022. What was published, whichever keywords were used are in this color. Yellow represent the most recent keywords. So in results, you need to mention what this graph is about, co-authorships, what is the weight, what is the score, how many clusters, how many links you have, and which are the authors that are recently publishing on particular topic. Based on your objective, you can extract the information and present in your results. Bibliographic coupling, showing one. bibliographic couplings, I've already told, but I'll repeat that it shows the similarity in references. Now, in this graph, there are too many items and too many connections, so it is difficult to interpret. I need to reduce my number of items to make it more clear. I can use frames also, but then the connections are less visible, so I prefer using circles. Now there are four options in weight. We can change node size according to total link strength or citation or links. Whatever your suits to your analysis, you can select and generate accordingly. Anyone, any question?
Ma'am, one question.
Yes.
Ma'am, how do we decide the weights? Like this graph is for bibliometric coupling. So weight we do we select? How do we decide that?
Whatever you want to highlight. If you want to highlight the most citations, number of citations, there's no wrong or right. What you want to highlight, you can select.
Okay.
Okay.
Okay, ma'am.
Thank you for the question. So I think we should end this now. Anyone, any questions you can ask? Or anyone want me to generate any particular graph? Or anyone want any further explanation in particular type of graph? Please let me know.
Thank you so much, Dr. Namrata, for the insightful session and practical demonstration. The strategies and techniques shared today will surely enhance how we present and interpret our findings. So now we open the floor for questions. If you have any query, you can type them in the chat box. As of now, there is no question in the chat box.
Okay. Then I think
So,
we can end here.
yeah, we can. So before we conclude, I'd like to thank Dr. Namrata for her valuable time and expertise, and all of you for your active participation. Let's continue this learning journey in the upcoming sessions, and we look forward to seeing you again. Have a great day ahead, and thank you so much. Thank you, ma'am.
You're welcome, Dr. Ravita. Okay. Thank you everyone for listening patiently.
Thank you, ma'am.
If you have any query, you can ask me later also. Okay. So have a nice time. Bye.
Bye, ma'am. Thank you so much.